Good afternoon, and it is a pleasure to be here, and thank you so much for inviting me. I appreciate very much being on such a distinguished panel to discuss supportive housing for young people transitioning out of foster care and the particular challenges that these people face having been in our care. We know that supportive housing saves lives, and it can keep children and young people safe as well as strengthen families. But how do we best deliver this service to our young people transitioning out of our foster care system? As the Commissioner of Children's Services in New York, doing all that we can to provide access to housing for young people transitioning out of care is obviously vital to our mission, as well as our basic responsibility to young people. Currently, there are approximately 2,300 young people in care who are between the ages of 18 and 21. And while we have been successful in ensuring that many are residing with families, about half of these young people will need housing as they transition out of care. All young people in New York City who are living away from their families struggle with housing. But for young people who have been in foster care, the challenges are obviously even more daunting. Whether they came into care as a child or as an adolescent, many of our young people have experienced trauma and have complex behavioral challenges resulting from that trauma, including substance abuse and education issues. As young people on the threshold of adulthood, the added responsibilities compound these challenges. Securing stable housing is critical to achieving successful adulthood. In addition to helping our young people secure housing, it is equally important to prepare them to maintain this important part of their lives. Housing providers, in many cases, are challenged when trying to address the unique needs of 18 to 25-year-olds with cross-systems needs. Adult programs are particularly challenged, programs that serve adults, to integrate our young people into their programs effectively. In terms of social services, young adults straddle the youth and adult service worlds, fitting fully in neither, yet requiring support from both to achieve adult interdependence. Earlier this week, I was at a conference that was sponsored by the court system that you're going to hear a little bit about in my remarks, that talked about adolescence and talked about how adolescence lasts between the ages of something like 12 and 25. And it struck me how we expect so much of our 18 to 21-year-olds. And then this morning, I had the opportunity to be at a benefit for the Osborne Society, and a young man who had a mother who was also there, talked about what it was like to have his mother incarcerated when he was 14 and then leave jail when he was 17. And what was so inspiring but touching about his story was that you think about this young man who spent the time with family. He didn't enter the foster care system. What's so striking about his story was how emotional he was and how powerful he was and how he drew from that experience. But he was 14 and he's now 17. And I think about him in comparison to our kids and the fact that they are often with strangers during this critical time in their lives. I go on. Just the other day, I attended a meeting and heard this presentation on the research regarding the adolescent brain. And it discussed that in adolescence, the brain experiences a period of major development comparable to that of early childhood. The implications for youth are far-reaching. The research says that adolescents must take on distinct developmental tasks in order to move through emerging adulthood and become healthy, connected, and productive adults. The challenge for us in this business is that young people in foster care don't often have the necessary supports to successfully navigate that terrain. And we have to work to help them successfully achieve this transition while their brains are going through this extraordinary transition. Even under the best circumstances, an adolescent's sense of social responsibility is still emerging, and many individuals in the age group entering the adult system have grown up in far from ideal circumstances. And I remind you, adolescence goes until 25. I don't know, many of you probably have young people in your lives or are parents or aunts or uncles or maybe are young people yourselves. 25 is when adolescence ends and young adulthood begins. In addition, the developmental consequences of trauma in the life of a young person can't be overstated. Young adults who have experienced complex trauma often develop behaviors and coping mechanisms that may appear confusing or even irrational to someone who is not familiar with this dynamic. The greater the sensitivity among providers to the unique characteristics of these young people, the better the needs of these vulnerable young people can be served. A significant barrier to securing and maintaining housing is a result of the very nature of being in care. Oftentimes, our young people don't understand the importance of keeping appointments, showing up on time, or providing correct documentation. Some of this is, of course, due to what any parent would probably call a teen being a teen. But for a young person transitioning out of care, missing these deadlines can mean the difference between having stable housing and a far less desirable outcome. Identifying stable housing is one of the many issues that these young people face, including finding meaningful employment, attaining an education, and connecting with an adult who can serve as a permanent resource for that young person. These issues are often interrelated, with one impacting the other, including maintaining stable housing. And we know that in order to prepare young people to leave our care and achieve success, we need to make sure that they are prepared educationally, emotionally, and have the skills necessary to support them for a lifetime. Among many factors, maintaining stable housing requires the ability to become employed and to stay employed. For those young people who will likely not be reunited with their families or adopted, we are working with our provider agencies to make sure that those who transition out of care with the goal of another planned permanent living arrangement, or APLA, that they really do have the support they need for a successful path to adulthood. We have retooled our APLA monitoring unit at ACS to promote quality practice standards to support achievement of the preparing youth for adulthood in the areas of housing, education, employment, and other important life skills. For example, we are supporting youth employment by building partnerships with workforce development programs and advocating for jobs and internships in the city's summer youth employment and young adult internships program. And we are working with the New York City Employment Coalition to forge a partnership to increase employment opportunities for youth currently in and transitioning out of foster care. This partnership has provided both training opportunities and internship opportunities for our young people. Another challenge for some of our youth is being pregnant or parenting and transitioning out of care. For our young women transitioning out of care, they face many obstacles when balancing both their transition into adulthood and their new role as parents. And we estimate that approximately 10% of the young women in care at this time are parenting. To help our young people prepare for successful adulthood, we are committed to ensuring the expansion of services to reduce teen foster care pregnancy rates through targeted interventions to support young women and men in foster care, while also providing the parenting youth with the tools they need to become effective parents. There are approximately 300 to 400 infants, toddlers, and children living with their teen mothers in foster care in New York City. We estimate there are additional 50 or 100 children of parenting teens in care who are separated from their parents. We know from experience that the children of our foster teens are at higher risk of abuse and neglect because many of our teen parents are simply not prepared to care for their children, much less take on the difficult task of becoming the main breadwinner, which you are required to be in order to pay for your housing. Our maternity and mother-child blended residential care programs are available for single females who are either pregnant or parenting and need supportive services that cannot be provided in a foster home setting. This program provides stable care for the mother and child while giving the young mother the skills needed to become a better parent. The components of this program include parent training and support for foster parent and the parenting teen, skills training for the parenting teen, family therapy and aftercare services, and academic support for the parenting teen, among other support services. In addition, we are working to support a pilot project involving 4 of our foster care provider agencies who would work with pregnant and parenting teens in foster care and their children to deliver intensive services to these families. The goal is to reduce the rate of teens having another child while in care, as well as reducing abuse and maltreatment rates among the parenting young women in our care. We are also stepping up efforts to recruit foster parents who are willing to care for and nurture pregnant and parenting teens and their babies. As part of these efforts, we are launching an ad campaign on subways and media outlets encouraging New Yorkers to opening their homes to pregnant and parenting teens. In terms of housing initiatives, over the last several years, ACS has been developing partnerships and housing models for young people and families in our child welfare system. ACS developed one of the first housing units in the child welfare system across the country. We provide a housing subsidy grant to pay for move-in costs, such as first and last month's rent, and we also provide our young people with another subsidy grant to purchase furniture if needed. It's a one-time grant. ACS has a strong relationship with NYCHA, the city's housing authority, to assist our young people and families in applying for public housing. This relationship gives priority access to public housing for families reunifying with children from foster care and for those young adults transitioning out of foster care. As a former judge, I know this does not always work smoothly, and that is an understatement. In 2007, ACS signed on to the historic New York 3 city-state agreement, which developed 9,000 units of supportive housing for a variety of individuals and families facing long-term homelessness and disabling medical conditions. The latest New York 3 agreement was the first to include young adults transitioning out of foster care as an eligible population due to their risk of homelessness upon discharge, setting aside 200 units for this group of young people. ACS is collaborating with the New York City Department of Mental Health, HRA, and 8 New York 3 grantees to partner with the Corporation for Supportive Housing and the Supportive Housing Network of New York in an ongoing collaboration to ensure that grantees develop effective program models and ensure that the hardest to serve young adults have access to the units. We are working with HRA and the 8 providers to facilitate young adults' transition into supportive housing and to educate caseworkers and young people about supportive housing. As you will hear from Melissa later, we currently have 36 young people in supportive housing with Lantern Group, one of the New York 3 providers. I'd also like to tell you about another program that we have in place. Beginning in 2008, ACS partnered with the Local Initiatives Support Corporation to launch an innovative pilot program called Independence Starts at Home. This program links youth transitioning out of foster care to stable, affordable housing, workforce development, and education opportunities, and wraparound supportive resources. In its first year, the pilot program provided housing and supportive services to 24 young people. We continue to expand this initiative, partnering with the Local Initiatives Support Corporation to identify housing units for our youth. LISC also participates in trainings we offer to our youth that focus on being a good tenant and maintaining the apartment. Unfortunately, the freeze on Section 8 vouchers has had a significant impact on our youth and has affected their ability to obtain housing. In addition to ACS's work to ensure that young adults leaving care can access affordable housing with support services they need to stay housed, ACS has been committed to using supportive housing to prevent children coming into foster care wherever housing instability is the major threat to child safety. In 2007, ACS worked with the Corporation for Supportive Housing on a pilot project funded by the Robert Wood Johnson Foundation called Keeping Families Together. The goal of the pilot was to determine whether or not families encountering multiple challenges, like homelessness, substance abuse, and mental health issues, could successfully parent their children in supportive housing. ACS worked with the Department of Homeless Services to identify eligible families for the pilot and then continued to work in an interagency collaboration led by CSH to ensure that ACS protective and preventive staff were coordinating services with supportive housing providers to ensure families received comprehensive wraparound services. Many families benefited from this innovative program, and we are currently seeking federal funding to continue these efforts to serve young people and families who come to the attention of the child welfare system due to severe housing issues and high service needs. We own the challenge to engage our partners in a discussion to explore new opportunities to expand services and fully engage our young people in planning for their futures and ensuring that they have adequate access to housing. Yesterday afternoon, I had the opportunity to meet with a representative from the Bill and Melinda Gates Foundation, and they are doing extraordinary work on housing issues directly at the intersection of the child welfare and homelessness systems. And they have made extraordinary progress in Washington State. And we talked about the current, I don't know if it's called an RFP, but the current grant that's out on the street that involves the kind of work that we did in New York with CSH. There are opportunities out there. They require a good deal of collaboration and a demonstration that agencies like mine are willing to step up and identify housing and identify social services partners and identify city partners. We are committed to figuring out how to do this. I cannot tell you how many cases, while I sat as a judge, involved families in the shelter system here in New York, and how many families, if I would have polled, had been in the shelter system within the past year or two of being the subject of child protective proceedings. The gentleman from the Bill and Melinda Gates Foundation said that their research demonstrated that 40% of families who come into the child protective system have had some period of homelessness in the 12 months preceding their introduction into the child protective system, and I would not doubt that our numbers in New York are probably very similar to that. Housing instability is clearly a contributing factor to child protective issues. It's very difficult to take great care of your kid when you don't have a house to live in or an apartment to live in, and you're always on the run trying to figure out where you're going to sleep. Supportive housing is obviously a model that has been shown to work and can address the complex needs of many of our young people transitioning out of care. And I look very much forward to the conversation this afternoon. Again, I thank you very much for making Children's Services part of this discussion.